Have you ever felt an itch somewhere on your body? An annoying sensation that just keeps coming back day after day, even though there's no mosquito bite, no allergic reaction, and you haven't switched to a new cosmetic product. Your skin looks perfectly normal, smooth, no rashes, no redness, no flaking. And yet, the itch is there, persistent, nagging, as if something is happening beneath the surface of that seemingly healthy skin. You try applying lotion. Nothing changes. You switch your bed sheets, change your shampoo, wear looser clothes. Still no relief. Eventually, you think, it's probably just dry skin. Happens with age. And you let it go. The itch continues, but since there's nothing obvious to see, you shrug it off as something minor. But if you're over 60, I'd like to ask you to pause for a moment. Because sometimes it's the smallest things that speak the loudest about what's going on inside your body. At this age, the body doesn't respond as forcefully as it once did. It doesn't always spike a fever when there's a problem. It doesn't always produce intense pain. Instead, it sends you quiet, subtle, yet persistent signals, like a whisper, repeated over and over. One of those whispers is itchiness. It may sound simple, but throughout my years in medicine, I've seen many cases where a persistent, unexplained itch was the first clue to something much bigger. In many patients, especially older adults, an itch that appears in one specific spot doesn't spread, doesn't turn red, and doesn't respond to creams or ointments turned out to be an early symptom of serious illnesses like lymphoma, leukemia, skin cancer, pancreatic cancer, breast cancer, or even cancers of the reproductive organs. The real issue isn't how painful or irritating the itch is. The real concern is that it stays, quietly, repeatedly, refusing to go away. It's like a tiny alarm bell, so faint we often ignore it. But for those who pay close attention to their bodies, who dare to ask the simple question, why does this spot keep itching and never stop? That question could become a life-saving moment. A chance to detect disease early, a chance to treat it in time, a chance to protect yourself or someone you love from a serious condition silently taking root inside. I'm not sharing this to scare you, and definitely not to make you live in fear. My goal is to help you understand your body better, to remind you that a persistent, unexplained itch, if it lingers, if it doesn't go away no matter what you try, deserves a proper checkup. Because the earlier you catch something, the better your chances of treating it. And sometimes, what saves a life isn't a fancy machine. It's simply noticing something small at the right time. We often think cancer shows up with obvious lumps, intense pain, or dramatic weight loss. But in reality, some types of cancer don't present that way. They don't hurt at first. They don't swell up noticeably. They just send out faint signals, like an itch. And if we listen, we might just stay one step ahead of the disease. In today's video, I want to take you through 5 specific areas on the body where this kind of itch tends to show up. These are locations that, in numerous real-life cases, both in Vietnam and around the world, have proven to be early messengers of cancer. And it all begins with a sensation we often dismiss, an itch. And we'll start with a particularly surprising spot, a place most people wouldn't even consider, a region that, when the immune system is struggling or the lymphatic system is damaged, often becomes one of the first to send a signal, the shins. You might be thinking, itchy legs? What's the big deal? But please, stay with me for the next story. A story that's become a constant reminder to me. Never underestimate an itch without a reason. I still remember Mr. Thon very clearly. A man in his early 70s, slim build, slow-spoken. He didn't come in because of pain, not because of a fever, but for something that sounded almost trivial at first, a persistent itch on his right shin. It had been going on for an entire month. No rash, no redness, no insect bite, and not due to dry weather. He had changed his bedding, switched soaps, tried every kind of moisturizing cream. But the itch kept returning, always to the same exact spot, like something stubborn buried deep under the skin that he just couldn't scratch away. He told me there were nights he couldn't sleep because he had to keep scratching, frustrated, uncomfortable, and confused about what his body was trying to tell him. It wasn't until he began to feel more and more fatigued, even though his appetite stayed normal, and noticed he was gradually losing weight, that he decided to go in for a deeper checkup. And that decision turned out to save his life in a completely unexpected way. Scans and blood tests revealed that he had lymphoma, a type of cancer in the lymphatic system. Thankfully, it was still in its early stages. And what was remarkable was that his very first symptom wasn't pain, or swollen lymph nodes, or a cough, or exhaustion. It was an unexplained itch on his shin. It might sound odd, even illogical, but in fact, this has been documented in many medical studies. When the lymphatic system starts to malfunction, especially when cancerous cells begin to appear, the body tends to release inflammatory substances that spread throughout. These substances strongly stimulate the sensory nerve endings located just beneath the skin, and one of the most affected areas turns out to be the legs, where blood and lymph circulate constantly, yet often go unnoticed. What's unique is that this type of itch isn't like a regular itch. There's no rash, no bumps, and it usually doesn't respond to topical treatments. You could switch out every skin product you own and still get no relief, because the issue isn't in the skin, but deeper, in a struggling immune system. That's why, if you or a loved one is dealing with a persistent itch on the shin that doesn't spread, doesn't come with a rash, and has no clear cause, don't ignore it, especially if it lasts for weeks or even months and comes along with vague symptoms like fatigue, night sweats, or unexplained weight loss. It's time to get a thorough checkup. Just a simple blood test or a basic ultrasound could uncover what your body has been trying to tell you, in the quietest of ways. And as Mr. Than once said, "I never thought a little itch, something I assumed was nothing, would be the very thing that saved me." That statement isn't just for him. It's a gentle reminder for all of us. Don't rush to dismiss the body's repeating signals. Don't automatically assume an itch is just dry skin, because if you listen at the right moment, you just might change the course of your life. And now, after the shins, let's move upward to the back. Specifically, the area between the shoulder blades, a place many people blame on warm bedding or sweat, but in reality, it can be the very first knock at the door from a disease that's notoriously hard to detect: pancreatic issues. Many people who've experienced itching in this region have assumed it came from simple causes: a hot mattress, back sweat during summer, tight clothes, or constant friction on the skin. And yes, sometimes those things really are the cause. But if you've changed your mattress, swapped your shirts, applied ointments for days, and still the itch remains, if there's no rash, no redness, no spreading, just a steady, pinpoint itch day after day in the same spot, your body might be asking you to listen to something deeper. I remember clearly the case of Miss Hong, a 70-year-old woman from Baklio. She was meticulous, clean, and rarely got sick. But a few months before coming in for a checkup, she had been constantly complaining about an itch in a very specific spot on her back, right below the neck. She tried everything: changed her mattress, switched detergents, wore more breathable clothing, applied ointments, but nothing helped. She scratched so much the skin started to peel, yet the deep, crawling sensation persisted, like something was shifting just beneath the surface. What stood out was that this itch didn't feel like a typical skin itch. It was deeper, more unsettling, the kind that gnaws at you from within, and no amount of scratching brings relief. Then one day, during a routine health checkup, her doctor noticed her liver enzymes were unusually high. An ultrasound revealed a slight compression of her bile duct. Further imaging brought the real surprise. A small tumor was quietly forming at the head of her pancreas. It hadn't caused her any pain, no weight loss, no fatigue, but it had already triggered a persistent itch between her shoulder blades that had lasted for weeks. At first glance, it might seem unrelated. The pancreas is in the abdomen, so how could it cause itching on the back? But in medicine, this connection is well established. When the pancreas is compromised, especially if a tumor begins to press against the bile duct, bile can't flow properly. It starts to back up. Bile salts seep into the bloodstream, and from there, travel throughout the body, irritating peripheral nerve endings. One of the areas most affected is the upper back, where sensory nerves are densely concentrated and closely tied to the central nervous system. Itching caused by bile salts isn't pleasant. It doesn't show up on the skin's surface. There's no obvious rash or inflammation, but it creates a deep itch, the kind that scratching never really relieves. And what's even more important, this kind of sensation often appears long before other clear symptoms like dark urine, pale stools, loss of appetite, or weight loss. So if you're experiencing something similar, a persistent itch in the middle of your back, without rash, without relief from creams, please don't ignore it. Especially if you've also noticed changes like fatigue, darker urine, or a decrease in appetite. It's well worth getting your liver, bile ducts, and pancreas checked. The pancreas is one of the most difficult organs to detect disease in once it's too late. But if you can recognize a seemingly unrelated symptom, like a nagging itch on your back, you might just stay one step ahead of a very serious illness. And just as the back can point to something deeper in the abdomen, the scalp, an area we rarely give much thought to, can also be where diseases of the blood or skin begin to quietly whisper their warning. We often brush off an itchy scalp as no big deal. Maybe it's the shampoo, the heat, or dry skin. But if you pay attention, you'll notice there are times when the itch doesn't come from the outside, but from your blood, from within. Let's now take a closer look at a very sensitive, but often overlooked area, the scalp. Scalp itch is something many people are familiar with. Sometimes we wear a hat too long, sweat a little too much, or the weather's just too hot. And suddenly, we're scratching. Maybe we switch shampoos, give it a few days, and forget about it. Hardly anyone thinks a scalp itch could mean anything serious. It's normal, it's common, and it's so easy to dismiss that we almost never give it a second thought. But there's a type of itch that's different. A deep, persistent itch beneath the skin of the scalp, like something is moving slowly, subtly, deep inside, just out of reach. No dandruff, no flaking, no rash, no swelling. Everything looks normal on the outside, but inside, there's an uncomfortable restlessness that returns day after day, often more noticeable in the late afternoon or at night. I'll never forget the case of Mr. Lam, 73 years old, living in Hue. He came in with a complaint that sounded simple enough. I've had an itch behind my left ear for over a month, and it just won't go away. At first, he thought it was due to his shampoo, so he switched to a gentler one. When that didn't help, he stopped using any chemical products altogether. No hair dye, no sprays. Still, the itch wouldn't let up. There was no rash, no dandruff, no redness. But the deep, persistent itch felt like it was coming from beneath the scalp itself. It wasn't until he began feeling more tired than usual and occasionally lightheaded that he decided to get a full checkup. A blood test revealed an abnormally high white blood cell count, a clear sign of a blood cell disorder. After further testing, he was diagnosed with early-stage leukemia. Fortunately, it was caught before it progressed too far. And the very first thing that alerted him that something was wrong was a small, persistent itch on his scalp that had lasted for weeks. In fact, this isn't rare. When cancerous cells begin to appear in the bloodstream, the immune system often reacts by releasing inflammatory substances. These spread throughout the body via the blood and stimulate sensory nerves under the skin, especially in sensitive areas like the scalp. That's why this itch doesn't come from external irritation, but from within, from the blood itself, when something's gone wrong. It's not just leukemia. Certain types of scalp skin cancer can also start with very subtle signs. The skin on the scalp may thicken slightly in one spot, feel a little rough or itchy. For people with thinning hair, older adults, or anyone frequently exposed to the sun without protection, precancerous lesions on the scalp can develop unnoticed, unless someone checks closely. So, if you or someone you know is dealing with a persistent itch on the scalp, always in the same spot, with no dandruff, no redness, and no improvement despite switching shampoos and keeping clean, don't ignore it. Get a health check. A simple blood test could reveal important clues about your immune system. And if possible, have a loved one, a hairdresser, or a medical professional inspect your scalp directly to make sure nothing unusual is hiding beneath your hair. Sometimes, what saves a person's life isn't intense pain or dramatic symptoms. It's the quiet persistence of something seemingly insignificant, like an itch. And if the scalp can signal something deeper in your bloodstream, then the chest, a place we tend to be more aware of, must never be overlooked, especially because some forms of breast cancer don't start with a lump at all, but with a very mild itching sensation. Now, let's dive into that specific warning sign, itching around the chest or nipple, and what might really be going on beneath the surface. Many people have experienced a mild itch in the chest area and brushed it off. Some think it's because their bra is too tight, because they're sweating, the weather's hot, or they used a strong detergent. And yes, often those are harmless causes. But if you've already changed your clothes, switched laundry soap, kept the area clean, applied lotion, and the itch still returns in the same spot week after week, it may no longer be just a skin issue. I once treated a patient, Miss Leo, 69 years old, from Bentray. She said she kept feeling a mild itch around her right breast. No burning, no rash, just a subtle, persistent itch, like something brushing from the inside every time she wore a bra. She stopped wearing underwire bras, switched to softer fabrics, applied creams, but nothing changed. She assumed it was hormonal, a postmenopausal issue. But a few months later, she noticed the skin around the itchy spot had thickened slightly. When she touched it, it felt faintly puckered, like the texture of an orange peel. And there was a noticeable warm sensation, especially when wearing tight-fitting clothes for too long. When she went in for an ultrasound and biopsy, the results stunned both Miss Leo and her family. It was inflammatory breast cancer, a form of the disease that doesn't present as a typical lump or noticeable swelling, as most people would expect. Instead, its symptoms were subtle: slightly thickened skin, prolonged itching, or mild discoloration. If not caught in time, it can progress rapidly, leaving little room to react. What's important to understand is, this isn't something only women should be concerned about. I once had another case, Mr. Kwang, 72, from Da Nang. He had a mild itch around his left nipple, just about the size of a fingertip. No rash, no pain, just a slight discomfort. He told me it itched in the morning after waking up. He'd forget about it during the day, and then it would come back at night. After more than a month without improvement, he decided to get checked. The diagnosis: early-stage breast cancer. It might sound strange, but men do have breast tissue, and male breast cancer, though rare, is often overlooked, simply because most men don't believe it could happen to them. That's why, whether you're male or female, if you've been dealing with persistent itching around your chest, especially near or under the nipple, without any rash, without relief despite careful hygiene, don't assume it's just your skin or your bra. Look closely. Has the skin thickened slightly? Does it feel unusually warm or irritated? Is there any unusual discharge? If yes, please get it checked. A simple breast ultrasound or skin biopsy could be the key to catching something your body has been trying to alert you to for weeks. And if the chest, a part of the body we can easily observe, can still go unnoticed when the only symptom is itching, imagine how much easier it is to ignore symptoms in a more sensitive, more private area: the anus and the genital region. Many people, especially older adults, feel too embarrassed to talk about itching in the genital area. They chalk it up to internal heat, poor hygiene, or aging. But just like other parts of the body, sometimes that itch is not ordinary, and it can be the very first sign of something serious. Let's take a step into this often ignored territory and understand why itching around the anus or genitals should never be taken lightly. A great number of elderly individuals, men and women alike, have experienced burning or itching in the genital or anal region. And the most common self-diagnoses follow a familiar script. It must be because of spicy food, maybe I'm not cleaning properly, or in older women, it's just menopause. Then comes self-treatment: creams, suppositories, changing underwear, dietary changes. For some, the symptoms improve slightly, only to return. Others feel no relief at all. But because of embarrassment or fear, or simply thinking it's just an old age thing, they choose to say nothing. But there are cases where that silence allowed precious time to slip away. I still remember the story of Mr. Duong, 76, from Tay Ninh. He had been dealing with itching around his anus for nearly a year. At first, he assumed it was hemorrhoids, so he bought topical creams and later oral medication. Sometimes it eased slightly, sometimes it flared up worse, especially at night. Too embarrassed to see a doctor, he brushed it off, thinking, old people get these things. Eventually, exhausted from sleep deprivation, he followed his children's advice and went in for a colonoscopy. The result shocked him: early-stage anal cancer. Fortunately, the tumor was still small and had not yet spread. Then there was Ms. Diem, 68, from Kianjiang. She experienced persistent itching on one side of her genital area. Very specific, not widespread, and not intensely painful. She assumed it was due to postmenopausal dryness, possibly hormonal changes. She used vaginal suppositories, moisturizing gels, even herbal rinses. But the itch remained. It wasn't until she noticed the skin in that area had become slightly rough and darker than usual that she sought help from a gynecologist. After a biopsy, doctors confirmed abnormal cells at the edge of the vulva, a precancerous condition that, if left untreated, could have developed into late-stage vulvar cancer. She recalled emotionally, "I thought it was just mild inflammation. I never imagined the itch would be the thing that saved me." Hearing all of this might leave you feeling uneasy, but the goal here isn't to scare you. It's to remind you that itching, if it lingers, stays in one spot, has no clear cause, and doesn't respond to normal care, should never be taken lightly. This is especially true for sensitive areas like the anus or genitals, where uncommon but very quiet types of cancer can begin to develop, such as anal cancer in older men, or vulvar, cervical, and penile cancers in those with certain risk factors. An itch that seems so small could be the first knock at the door from something much bigger. And if you're going through something like this, or know someone who's silently enduring it without speaking up, then the most sincere advice I can give is, please, get it checked. There is nothing shameful about listening to your body. What is truly a shame is knowing something's wrong, but staying silent until it's too late. Because sometimes, a tiny itch can save an entire life. My dear friends, we've just gone through 5 areas of the body where persistent itching might be an early sign of cancer. You might be thinking, but everyone gets itchy. That's true, but the important question isn't whether you itch. It's how you itch, how long it lasts, and whether it ever goes away. Itching on the shins can be the quiet voice of a troubled lymphatic system. Itching between the shoulder blades might be one of the earliest signals from the pancreas. Itching on the scalp could point to blood irregularities or subtle skin damage. Itching around the chest might not just be an allergy or a tight bra, but an early warning of breast cancer. And finally, itching around the anus or genitals could be a silent alarm from a deeply private place that desperately needs your attention. Not everyone who itches is sick, but those who ask the right questions about their itch may be the ones who seize the chance to live long before others even realize they're at risk. And if you've stayed with me this far, then I believe you're ready to stop being silent about what your body is trying to say. Please don't hesitate to share this video with your loved ones. You might not realize it, but one act of sharing today could save someone's life tomorrow. Thank you for listening. And may you always live healthy and live peacefully, one day at a time.